Welcome back to Living Dayton. Thanks for joining us today. We're talking about a health problem that can lead to autoimmune disorders and chronic disease. Dr. Roz is here with more on the topic and what you can do to achieve optimum health. Welcome back.
Great to be here.
So last time we touched on this subject. Tell us what it is and kind of how it's affecting us.
Okay. Well, we're talking about anti-aging, and what we brought up, or what I brought up, was the leaky gut.
Okay.
And we both said, you know, like, wow, that doesn't sound very sexy, and it's not. And so I'm here just to define, like, what is leaky gut and how it affects our health adversely.
Okay, so yes, tell us kind of what you kind of have an opinion of what it might be in your head, but it's a little different than you're thinking.
It's a little different. So there's bacteria in our body that's supposed to be there.
Sure.
It's microbes. It's part of our microbiome. We're supposed there's bacteria, microbes everywhere.
Good bacteria.
Good bacteria. But when we have an overabundance of bad, then it creates problems in our bodies.
Sure.
And as far as the gut is concerned, because the gut's loaded with bacteria, that's how we break down foods.
Okay.
But when we don't have the bacteria that's there to break down those foods, and so things that we would normally eliminate through our waste, our body absorbs it through the blood. And then our normal response with our immune system, that we develop antibodies. And so you've heard the saying that, you know, my body's attacking my body because I have antibodies that's affecting other areas of my body. Well, that's how that happens, and that's how autoimmune diseases occur. Okay. So it's all about keeping a healthy microbiome. It's your normal microbiota. I like that word better than leaky gut syndrome.
I like that too. So having this can actually lead to some autoimmune disorders, some aches, some pains. Kind of talk to us about that.
Absolutely, and that's how it happens. So once you get these antibiotics, wherever it shows up in your body, whether it's in your joints, you may have rheumatoid arthritis. If it's in your skin, it's eczema. So it could be cardiovascular disease. And so how do we prevent that is lowering this inflammatory response or this immune response. And we do that by what we eat. It's all about developing good habits. Okay. Now, this is the beginning of the year. We're just trying to eat healthy. We want to be healthier this year. So practice a new habit of bringing good foods, alive foods into your body, like probiotics. Okay. Probiotics could come with a supplement, or you can eat foods that are live, like yogurts, kimchi, kefir, olives, things like that, fermented foods.
So those can really help, because the things that affect bacteria in our body can be things we eat. What else can it be besides stuff we eat?
I'm sorry. So like if we eat foods loaded with sugar, and so not good. And so that's going to create a response in our body that we don't want. So this inflammation that happens. So you don't want to take in lots of sugar, and you don't want to take in lots of processed foods. So it's eliminating those things from your diet and bringing in real whole foods, fruits, vegetables, probiotics that's needed. And then there's this new term, it's called a prebiotic. What that is the foods that the probiotics need to grow. Now that's a lot, but it's all about eating good, wholesome foods.
Okay, and there's some on the screen there: ginger, onion, garlic. I can smell that in the kitchen right now.
Smells good.
Beans, eggplant, things like that can really help this process and kind of help the good bacteria in our bodies to continue to break down.
And it's so significant. If you think about it, babies who are born to moms, there's a reason we want babies to deliver vaginally, because they're getting exposed to all that good bacteria versus a cesarean section. Okay. And so a baby's or infant's microbiota is determined very early in its life, and so it's important to be exposed to germs. You know, that's a good reason that elderly patients should have pets, not just to keep them moving, but it brings a different set of germs to the mix, which is actually a good thing.
So we talked about what you eat, your age, the way that you are born, chronic meds, your lifestyle, all of that can really affect the bacteria in your body.
Absolutely.
And pets as well, you mentioned.
Yeah, pets. Yeah, they lick you.
They have lots of bacteria.
Right. And so it's, again, you know, you want a diversity in your microbiomes. Yeah. And so versus, you know, not having that bacteria, you want that. We need it. Yeah. Yes, to be healthy.
It's an interesting topic, you know, something that you touched on last time you were here. You also do a newsletter that can kind of help us navigate this if we're having some of those symptoms. Where can we get the newsletter? Where can we find you?
Well, you get that newsletter on my website, and that's Total Health and Wellness, OBGYN, or drrozmd.com. You can also find out if you'd like to have your intestinal permeability checked to see if you have a leaky gut. And look at my blog. This one is on the leaky gut syndrome, so lots more information on there.
And of course, lots more information on the website she mentioned. You can visit her there in Miamisburg or call the number at the bottom of your screen. Very informative. Thank you so much for being here.
Absolutely.
All right.